Good afternoon, everyone. My name is Christina Canton, and I'm a perinatal consultant with the Champlain Maternal Newborn Regional Program. And I'm so pleased to be moderating the session today in our series on postnatal care in a pandemic. The session today is supporting perinatal mental health, and it's actually our second series on this very important topic. In terms of the objectives that were promoted for this webinar, we want to learn about the priority concerns related to perinatal mental health that we learned through the CMNRP postnatal care rapid response data collection. We also want to develop awareness about available mental health resources in the region and beyond, and to describe features of innovative mental health initiatives in the region, and to identify tips and tricks for providing virtual mental health counseling and support. So a few housekeeping details before we get started. I wanted to let everybody know that we are recording the session for today. So we ask that everybody mute their microphone so that we have a very good sound quality for the recording. We are going to upload the recording to the CMNRP LIN's YouTube channel. So yes, we have a YouTube channel that we're slowly building with recordings from this webinar series, in addition to other work that we've done. There's the arrow for your mute button, so the system should be muting you. And during the question and answer period, there'll be an opportunity for you to be able to ask questions. So at that time, we invite you to unmute or to use the chat box for your questions. So I just circled the chat icon for anyone who's not familiar with Zoom. And if you're active on social media, you can use the hashtags perinatal mental health or hashtag mental health matters. And for our regional program, our Twitter handle is at CMNRP_LIN. So let's get active on social media throughout the presentation as well. So I think most of you are familiar with the Champlain Maternal Newborn Regional Program, or CMNRP. But for those who are not, basically we're a regional integrated program with a vision of achieving the very best health outcomes for childbearing families in Eastern and Southeastern Ontario. And we do that by working in partnership and collaboration to identify and create a high quality system across the perinatal continuum. So we have many different partners, including our hospital partners, public health, midwifery collectives, community health centers, academic research institutions, many partners, and many collaborators in the world of maternal newborn health. So to learn a little bit more about CMNRP, you can go on our website, www.cmnrp.ca, and look at a bunch of resources and documents about some of the work that's been done in the past and underway now. So the topic that we're going to be speaking about today in regards to postnatal care during the pandemic was really identified very early on when the pandemic was declared. We were hearing that families were having trouble accessing the follow-up care and support and services that they desired. And we heard from healthcare providers that they were very concerned about that same issue as well. So we were asked to form a task force to look at this issue to understand how we could better support families during this time. So here's a list of our members. The task force was formed in June, late June, and is co-led by Dr. Daisy Moores from the Ottawa Hospital. So she's a family physician, and I was co-leading that task force with her. And so we had a very committed group of members who met all through the summer and gave tremendous contributions to really understanding this issue. Most of the members were supported by their organizations to do this work, but a few of the members also were doing this on their own time. And so we just definitely appreciate everybody's contribution, time, and support to this important initiative. So what did we do through the task force? We created a healthcare provider survey to understand what was happening in the context of COVID. We developed a parent survey, And we were gathering examples of innovations so that we could share these examples across the region to inspire. And so the webinar series that we're hosting are really showcasing those innovations and celebrating people's successes and allowing opportunities for people to learn from those who have gone, paved the way. What have they learned? What's going well? What would they change so that others who might be interested in something similar can have, just some guidance and some direction and some insight. So this is the model for evidence-informed decision-making in public health. And so you can see the different circles of the types of evidence which help to contribute to making decisions. And so in the context of COVID, we know that the research evidence, so the purple circle here, was rapidly unfolding at a rate that we've never seen before. And it was quite a lot to actually keep up with and understand how to manage the COVID pandemic, among many other reasons. We wanted to talk with our partners in Eastern and Southeastern Ontario to understand what was happening at the community level, at the local context in regards to the pandemic. And of course, the green circle is about community and political preferences, more so about the family. And we worked very closely with our family advisory committee, and we'll hear from one of our members today. And then, of course, the impacts related to the public health resources and the tremendous support that public health units have been providing throughout the whole pandemic. So this guided the work of the task force. The other guidance that we looked to were the postnatal standards published by the Provincial Council for Maternal Child Health. And I'm just sharing a screenshot of the data collection tool for the healthcare providers. So you'll see on the left-hand column that there's a number of postnatal care indicators. In addition to that, we were looking at the Breastfeeding Committee of Canada, the breastfeeding outcome indicators. So we had 10 postnatal standards and we had 5 Breastfeeding Committee of Canada outcome indicators. The grade bars were kind of pre-COVID, what was happening at their organizations regarding the standards. And then the following blocks were the current situation in the pandemic. How had services changed in light of the pandemic? And then the final column on the right were limitations and barriers that organizations were experiencing. So in all, we had 42 data collection forms. So we received 16 data collection forms from community organizations. And so that included community health centers and community groups like La Leche League and other organizations like that. We had 10 hospital partners, 8 primary care centers. So that would be family health teams, primary care, physicians' offices. And then we also had 5 public health units and then 3 midwifery groups or collectives. So this was all through the summer. So that's a pretty good response rate, I would imagine. And we asked people to work with their colleagues to make sure that their responses were as comprehensive as possible. The last question on the data collection form was about priority concerns that they had. And breastfeeding came out as the top concern. The second concern was mental health. And the third concern was newborn follow-up. So we've already had a breastfeeding webinar, and my colleague Catherine Gascon is going to put a link in the chat box for that recording. Last week, we had a session, part 1 on mental health, which showcased some incredible innovations that are happening. In particular, how did programs switch to virtual care and support? We had an amazing presentation from one of our family advisors. And so what was she hearing from families and a result of a survey that she had done through her business? And then today we're continuing the conversation about other ways of providing care and support. And in the future, we'll be booking a webinar on newborn follow-up. If we look at the themes of the priority concerns, I put that all into a Wordle. And so that gives you a sense of the frequency of the words that show up. So the bigger the word, the more often that word was used. So you see the words support and care and access as coming up as the most significant concerns related to care during the pandemic. In terms of like specific things that people had shared through the data collection tool, they said that given the challenging times that COVID has created, we need to put more attention into teaching on maternal mental health and the available resources in the community. And that was a hospital respondent. A community respondent said, with no in-person programming available at this time, parents do not have the same opportunities to create support networks with others. They have fewer opportunities to share their experiences or chances to learn from one another. Another community respondent said, virtual programming is not the same as in-person contact. It's much more challenging to build a trusting relationship with clients so they feel comfortable enough to open up about the challenges that they're facing. A public health respondent said one doctor was offering postpartum depression group sessions, and there's a need for more of this, and I believe offering these groups prenatally would be key. Working on self-confidence, self-care, relaxation methods, all building up to building attachment with the unborn child would be better than simply offering support postnatally. And then the final respondent said, from the hospital, that we need to increase the knowledge of maternal mental health for new mothers and how to manage ideal expectations in this period. So I just selected 5 quotes that I thought were quite impactful in terms of why this was a concern for people at this time. So we have organized an amazing panel of presenters, and I'll introduce them one by one, and I think you'll be really impressed with what they have to offer. And so at this time, I want to introduce Charlotte Maloney. Charlotte is our amazing chair of our Family Advisory Committee. And we were just chatting about how long Charlotte's been involved with the Family Advisory Committee. So since 2014. So we've seen Charlotte give birth and bring her children to the FAC meetings over the years. And so today, Charlotte is going to share the voice of families regarding their concerns during the pandemic. And Charlotte, I'm just going to stop sharing right now so that people can see you.
Thanks, Christina. So as Christina said, I'm here to give the perspective of families and how all of these changes that are occurring in healthcare during the pandemic are affecting childbearing families. So, families are really feeling that extra stress and worry. They're worried, as we all are, about the virus itself, exposure to it, the dangers of it. And then on top of that, they're concerned about, how all these changes in policy will affect their birthing and postpartum experiences. So communication to families is extremely important. So families really need to know up-to-date information. So from the websites, from their care providers, they need to know that what they're receiving is reliable, because, families will be worried about if what they have is the reality. So, they might ask other families, oh, I heard this, is this really how it is? So before they can even really worry about how those changes are going to affect their birth and postpartum experiences, first they're worried about if they really even have the correct information. So, I think families are aware and very understanding of the fact that giving birth in a pandemic is going to look different. So really families, even if the policy isn't ideal, for example, the number of support people that they can have with them, really it's most important that they just know what the situation will look like when they go to give birth, so that they can plan and prepare themselves as much as possible. So, we always say that no 2 births are the same. So every time you're going to give birth, it's going to be a different situation. So there's that stress. And then on top of that, families have the extra worry of not even really knowing what their birthing environment is going to look like. And we all know, things are changing so quickly, policies are changing quickly. And I think especially first-time parents are probably have that, they have no base to go off of, and then they're dealing with all of these extra changes. Another important thing about communication is it's really important for families that communication within an organization is very clear and consistent, because it can be very distressing for families to be told different instructions from different staff, even in the same day. So it's really, really important for families to feel that they're being told the correct information, and that they have a good grasp of what's going on, really. So when families return home, they might feel very alone, and very unsure of where to go if there's an issue that comes up. So the best way to alleviate this is to really prepare them ahead of time as to what postpartum will look like. So, if the visits will be virtual or in person, what resources are out there, what those resources look like, again, if they're virtual, in person, and really where they can go if they feel like they need help. So one extra cause of anxiety is when families have an issue that comes up in between their regular checkups. So they might know and be prepared, okay, I'm going to bring my child in for their milestone checkups, for their vaccinations at these times. But then when an issue comes up in between, or they're not sure if there is an issue, there can really be a long wait. They might have to call and book a virtual visit. And then if their provider says, oh, we need to see you in person, there's an extra wait to see that in person, to have that in-person visit. Many doctors are not doing walk-in appointments anymore. And the parents, or even they might be told this, they might feel they have to go to the emergency room in the hospital, even if it's not a true emergency, just because they feel like they can't get that care in a timely manner. So I think we have to remember that families are going through their perinatal period with a lot less support than usual. And this isn't just, during the birth itself. So with the support people that can be in the room with them, it's also postpartum, because they really may not feel comfortable having visitors, bringing food, or, someone outside of the household coming in to provide care. So this can be really overwhelming for families, and also very lonely. Another thing is that the people who have no access or limited access to internet are even more isolated. So, all of these wonderful resources, if you need an internet connection to do that, there's definitely a gap there, people who are really alone with that. Another thing is people might not think about the advantages for their mental health of social support. So for example, play groups, or, story time at the library. So I feel a lot of families are, they're focused on their immediate health needs of themselves and their children. But really they, either these resources are not running at all, or they've moved virtually, but parents, they may not think, oh, I don't feel like I need to attend a mental health support group. So they might not seek that out, but really they're missing those wonderful connections that can be made with other parents, just through these social interactions. So it's really wonderful that there are so many wonderful resources out there, that people have found new creative ways to, change their existing resources or create new resources for families. So really the challenge is making sure that families are aware of these resources. I think this is always a challenge. So it's important that we, come up with ways that families can know where to look, and what's out there for them. And really, in the end, families, as always, they want to feel that their concerns are being heard, and they want to feel like they're, involved in their own care. So I did just want to say that the Family Advisory Committee has developed a family-centered care toolkit. So this is to assist healthcare organizations in the planning, implementation, and evaluation of family-centered care. So this is available on the CMNRP website under resources. So this is a wonderful tool for organizations. And also I wanted to just add that the Family Advisory Committee is available for consultation, for program planning, for organizations within our regions and elsewhere when available, depending on the details. So I'm not sure if there's any questions for me.
Thank you so much, Charlotte. I think you've really captured a lot of what we've been hearing for months. And we do have an amazing group of family advisors under your leadership, Charlotte. But we keep hearing, through their connections and the circles that they're part of, these common concerns. And I think you did such a great job of kind of summarizing them. So yeah, I think even in the pandemic, we can't remember that families are our partners in care. And I mean, this is why we're providing care, right? It is for the families that we service. And we see more and more webinars that talk about how do you parent partner during the pandemic for policy development. So it's just an important reminder that, if you don't have a family advisory group or patient advisory council at your organization, that we do have one regionally, and they're more than happy to provide input. And the best time to work with families is actually in the planning stage. So that's the most ideal time, but certainly they review things that have been developed and provide very poignant feedback, very helpful feedback. So at this time, we invite you to write in the chat box any specific questions that you have for Charlotte. It's such a busy time of afternoon, so she will be leaving us in a few minutes. So my colleague Carrie Ann Berga is monitoring the chat box, and we'll just see if there's any questions right now about Family Advisory Committee.
Yep, so you can go ahead and pop your questions in the chat, and if anything comes up later, we can always defer back to Catherine, who helps to lead that group as well, and bring questions and connect you with Charlotte as well. Thank you.
So no questions yet. So whenever you have to leave, Charlotte, no worries. We know how to find you. We're happy to connect any of you with the speakers as well. So if you need a little bit more time to think about the question or would prefer to connect offline, we're happy to facilitate those introductions as well. So Charlotte, thank you as always for your amazing leadership and your time in supporting the regional initiatives, work groups, and committees, and our partners. Thanks.
Thanks so much.
So next, we're going to move on to Jillian Azolos. So Jillian is a family support worker and health promoter through Carleton Community Health Center. And so Jillian's actually involved in a number of CMNRP work groups and committees. So she's contributes to the Breastfeeding Promotion Committee. She's a member of the Healthcare Provider Education About Substance Use work group as well. So today, Jillian is going to be speaking about some of her parent initiatives. Jillian, over to you.
Thank you. I guess I don't have control of my screen, so you're going to have to switch slides for me as we go. Thank you so much. And I just wanted to say thank you again to Charlotte, because, the voice that she's representing is really the reason we're here. It's so incredibly important. And we are really lucky in this region to have Charlotte heading up that group of people that we can get so much feedback from. And of course, what we're hearing from Charlotte is what we're hearing at all levels. So as everyone knows, March of 2020 was really exciting, and we had a massive lockdown as a result of the emerging pandemic. As a result of that, virtually overnight, parent support evaporated from community health centers, from Ottawa Public Health, from hospitals, from primary care providers, and from lactation consultants. And in that moment of distraction and lack of coordination and nobody really knowing what was going to happen next, a lot of folks decided that they needed to rally and provide some level of support for families while we muddled our way through everything and figured out how we were going to provide support going forward. In response to that overnight closure, Carleton decided to put together this virtual parent support program. Really, what I had done is taken all of the online prenatal breastfeeding information sessions, which were all fully booked for many months in advance and all had to be canceled overnight, and grabbed all of those parents and pulled them onto a Facebook platform where at that moment I just said, listen, I don't know what's happening yet, but at least if you're here, I can communicate to you quicker. But out of that developed an opportunity to have rapid information dissemination, to facilitate access to information and services. As that information became available to me, I was able to forward it out to this large group of parents. And we created online parenting sessions, service through Zoom, that covered topics such as breastfeeding, sleeping, crying, safety, maternal mental health, infant behavior and development, prenatal preparation and resources and what that was going to look like during a COVID pandemic, responsive parenting, nighttime parenting, et cetera, et cetera. And they were extremely well received. We also created a file section, which allowed us to update families as fast as we were getting information from CMNRP as they were putting together, you know, their information and disseminating it out to the community. I was able to put it up to the files and then disseminate it out to the parents. And we were also able to offer individual parent support for those who requested it. So over on the left of your screen, you'll see just a screenshot of some of the parents in one of the support groups. I was lucky enough to have, oh, you can go ahead, Christina, it's okay, you can go ahead to the next slide. I was lucky enough to have a group of 6 Ottawa University nursing students who came into the program in September. And of course, the first thing I said to them is, hey, let's do a survey. Let's figuring out if what we're doing is working and what we can possibly do to augment service and figure out if what we're giving these parents is actually what they need. And so between the weeks of April the 1st and November the 5th, we analyzed all of the Facebook analytics. We analyzed all of the programs that we had put forward, and we sent out a survey to families who had participated in the parent support and in the Facebook group. We had 54 virtual parenting sessions with 469 participants. We now, as of this morning, have about 380 parents in that group, and it is a private group that is by invitation only at the moment. 100% of participants were pregnant and parenting their first baby. And the participants were all across the region. We had people as far east as sort of Cornwall and as far west as Renfrew and as far south as Belleville who were coming into the group. So the vast majority were in Ottawa, but there were definitely people who were coming in from outside of our sort of core service region. 50% of the participants attended at least one session with their partner. This was really big news to us and really exciting because we hadn't anticipated that before we sent out the survey. So I hadn't even been asking the question when we were doing the Zoom sessions and I was trying to take attendance, you know, is your partner listening into the room? Because I could usually see mom and a baby, but sometimes I could see, you know, 2 parents, but I was really excited to hear that actually a lot of partners were attending. So now we actually asked the question. So that 469 number is probably underrepresented because we only started asking the question in October. Once clients came to the sessions, they stayed, even when their children passed the 3-month stage, because originally we had planned to provide this service for parents who are pregnant or parenting up to 3 months as sort of an interim stopgap to provide that additional support and information for new parents. However, guess what? COVID lasted longer than that. And as a result, we expanded it to 6 months, and now we are looking at expanding it to a year. Nearly half of the respondents had also asked for one-to-one support outside of the sessions. And a lot of that was around breastfeeding issues. Not all of it, but a lot of it. So we also captured some really great comments from clients. Lots of people said it was something that they pinned their week to. It really helped me gain confidence for the first few days of breastfeeding my newborn. It was really cool to see the other participants start to have their babies and hear about their experiences. The parents found that the information was relevant and tailored to their specific needs. And a lot of parents said to me that they really felt that they were getting better service and better outreach than they might have had without a COVID pandemic. So that was also really encouraging to hear. And I'm hoping that that's across the board and not just within this program. Thank you, Christina. Next slide. So the outcomes were really encouraging. Obviously, it was lovely to see that 100% would recommend the group to others. 100% reported that they had gained knowledge on infant and child development. 96 reported that they'd gained confidence, which of course was one of the primary outcomes that we wanted. But above and beyond that, and the main sort of target for this was this increased sense of wellness and a decrease in anxiety. And 88% of the respondents responded positively to that. So that was really nice to see. Lots of parents, 87% reported an increase in knowledge around responsive parenting, and critically, and this was so exciting, and I really, really want to explore this more deeply, but 80% reported having actually changed their parenting behaviors to be more responsive, which is a really big deal. So I'm looking forward to seeing how that pans out over the next months and years. 61% reported they had a greater sense of community, which was great because that's something that was, hugely missing in the beginning of this pandemic. And, as we heard earlier, the sense of community was something many parents were really saying that they missed out on the most. They were excited about being pregnant and excited about going to playgroups and excited about meeting other families, doing the same things. And all of a sudden that wasn't, an option for them. And this provided them an opportunity to actually make some linkages. So 82% reported knowing more about regional services, including the breastfeeding support since joining the group. And of course, that was one of the main points of the group. So I'm happy to hear that worked. And 54% actually accessed services that they learned about. 14% agreed that they had made other parent friends. Making parent friends out of a Zoom parent group is pretty hard. So I consider 14% a win, considering it's not something that I put the majority of my effort into with this particular program. So it is something I'll spend a little more time on in the months to come, but I was actually really happy to see that. And if you look down in the bottom, that little pie chart is actually a representation of the, oh my gosh, I have 1 minute left. Never mind. I'll show you that later. Next slide, please. Okay, quick recommendations. Critical that we are messaging both partners, knowing that 50% are bringing along a partner into these groups. Even if the partner is not visible on the screen, the messaging should be targeting partners and support people. 14% of the clients report not having any ongoing close support at all. And that is something that needs to be taken into consideration as well. Knowing that not only moms suffer from postpartum mental health issues, often partners do. And in fact, the latest Ontario data suggests that partners suffer more than moms. So we really need to take that into consideration and treat mental health as a family subject, not just directed to one partner in that collaboration. They asked for expanded information. We're doing that. We are making sure that the platforms are accessible because not everybody has Facebook. So we are providing the Zoom links through other methods at the Community Health Center. And everyone is adamant that they want this to continue after the pandemic is over. Last slide, please. Have you got the last slide there? It's coming.
Is it showing or no? The together apart? Okay.
So just really wanted to let everybody know that we put together these two little infographics to share back the information to the participants on the Facebook platform. The information available is now available in the 45-page report that I have written on the findings. And we have a poster presentation and an abstract. If anyone is interested in having that at in your center, you're welcome to it. And we also asked for individual stories from the families, and we got 7 wonderful stories that were shared to us from families detailing how the programming impacted their mental health. And they're lovely stories, and those are in the back of the report, and I'm happy to make those available to people. I'm done. I'm over time.
It's so hard because we limit our speakers to 10 minutes, and that's very challenging.
Jill's not limited.
Jillian always has lots to share and so many amazing innovations. So Carlington Community Health Center is a phenomenal agency, very supportive leadership, very innovative strategies. And so this is just a tremendous success stories. Again, the flip, to responding to the need that happened so quickly during the pandemic, and the evaluation piece, which is so valuable to then understand the impact. And I was fortunate to have a sneak peek at the report. I'm not allowed to share it yet, Jillian says, but it's an amazing report. And Jillian, whenever you do have the go ahead to share that, we would be pleased to share that quite broadly, just so that people can get more information about what you did and what you heard in terms of the impact. So Jillian, thank you so much. If you have any questions for Jillian, please put them in the chat box. And then after our next two speakers, we'll be able to address those questions. Thanks. So our next speaker is Dr. Stephanie Boyer. So Stephanie is a clinical psychologist at the Psychology Clinic at Queen's University, where she's actively involved in student supervision and training, as well as providing direct clinical services. Stephanie's clinical and research interests are broadly focused on women's health, with particular expertise in perinatal mental health, eating disorders, and sexual health. Stephanie completed her doctoral degree in clinical psychology at Queen's University in 2014, followed by hospital appointments at McLean Hospital and Harvard Medical School in Massachusetts. She's been on staff at the clinic since her return to Ontario in 2018. So we're really happy she came back to Ontario, where she's involved in a number of community mental health services for adolescents and adults, including her role as director of the Perinatal Mental Health Service. So Stephanie, welcome.
Thank you. Thank you so much for the opportunity to be here and share a little bit about the work that we've been doing. So if we'll just shift to the next slide, Christina, I'll start off by saying a bit about who we are and what we do. So we're a training clinic affiliated with the Department of Psychology at Queen's. So our mandate is to provide training to our clinical psychology graduate students in evidence-based assessment and treatment through the services that we're providing to our community in Kingston and the surrounding areas. So students are involved in everything we do. And we're always looking for opportunities to enhance their training in areas that they receive less exposure to in the program. And in turn, that allows us to fill mental health gaps that we see in our community. And perinatal mental health was one such gap we had identified even before the pandemic. And we were very fortunate we were able to obtain a grant to develop our service, which provides programming to new and expecting parents up to about a year postpartum. And we launched in January 2020, so right before the pandemic started. And I'll talk a little bit about how that's changed things for us, but just a bit about our service pathway. So people go through the initial steps in terms of, identifying referrals that are a good fit for our service, and then they come in to see us where we're thoroughly assessing any current symptoms they're having, their level of functioning, supports that they have through an interview and a battery of questionnaires they do online that are relevant to this population. And then we make some treatment recommendations. So we're connecting them with other things in the community we think may be a good fit, and then also talking about our programs. And so that might include a group program with us. We emphasize group-based treatment in our program. So one that allows us to cut down on wait time. So we don't want our parents to be waiting a long time if there's a need, they're needing support, they're reaching out. And so groups allows us to see more people quickly, but it also allows us to leverage some really meaningful and effective group therapeutic factors that I know are already coming up in some of the presentations we're hearing about. So I think one, developing a sense of, oh, I'm going to have you go back, Christina, I'm not quite ready for you. No, that's okay. Developing a sense of community and connection with other parents, I think so important right now with the isolation that a lot of new parents are experiencing and we've been hearing about today. And it also allows us to normalize mental health struggles, which can reduce stigma and shame that can be associated with that. And again, I think that's so important with what we know are increased rates of mental health concerns in general, but in this population specifically as well. So we had actually just held our first group session the day before our community went into lockdown. So things really literally shifted overnight for us, and we had to pivot to adapt our service delivery model to be able to be more virtual and, you know, be able to connect and support the families we were working with. And we can shift now, Christina, thank you. I'm going to share data about our virtual program we've been doing and some of the main takeaways I've had from this crazy shift in how we do our work and where we're going next as a result. So the program we've been offering since March is a cognitive behavioral therapy or CBT group for perinatal anxiety. We're on our 4th round that we've offered since March, all virtual. It's adapted from a program developed in St. Joe's and their Women's Health Concerns Clinic. So I want to plug them a little bit there. It's a 6-week program for new and expecting parents experiencing any type of anxiety symptom that they feel is distressing, interfering with their day-to-day life in any way, and they want to work on. And as some of you might know about CBT, it's a structured intervention. So we're really working on developing some coping skills that are focused in how we think and how we behave in response to anxiety and worry to better be able to manage those symptoms. And we also cover some strategies relating to symptoms of depression as well, because we know there can be high rates of comorbidity with anxiety in this period, in the perinatal period. So I'll have you just shift a little forward, Christina. Thank you. So I'm really excited to be able to share some data on what we're finding so far. So it's a small sample, but our data has been really resoundingly showing. So we have clients complete measures right before they start the group and right after. And so our pre-post data is showing decreases on all of the measures that we're looking. So we're basically the things that we're targeting in the group are going down, and all the averages that we're seeing in our first 3 cohorts were outside of what we would consider a clinically significant range. So their symptoms have really reduced to a level that would be meaningful in that way. So that's obviously really nice to be able to see and say. The other piece is, you'll see there in the table, I just have some data from the anonymous feedback surveys that we give after people complete programs with us. So things are rated 1 to 5. 1 would be the worst, 5 would be the best for that item. And I just pulled some of the data that I felt has been really meaningful in understanding what this shift has meant in how we do our work. So although we can't compare this to in-person data, since our groups have all been virtual, it is really encouraging to see our clients are satisfied with the program. They're developing the skills that they came to us for. And something that was really meaningful to me was in these last 2 items, seeing that they're still feeling connected to us as group leaders. They're still feeling attended to. So even with this shift, this is something I was really concerned about. We're still having this experience of connection in that therapeutic space. And so that leads nicely into my next slide, where I'm going to just share a few of my takeaways from this shift. So I think, first of all, maybe this shouldn't have surprised me because I have 2 young children myself, but it was a bit of a surprise to really hear from clients, including clients who had started a group in person with us. They were there with us that first day, and then we had to shift them to virtual, that they actually felt more connected and more present. So that was a word that came up a lot. I felt like I was able to be more present in the group. I was actually really able to connect with other people in a way I don't know if I would have in person. And I think some of this really makes sense in thinking about some of the demands that new parents are experiencing. So most of our participants have been postpartum. So the barriers and conflicts that they might face in trying to juggle their responsibilities in childcare, right? So how is group going to fit in with baby's nap today? What am I going to do if baby's fussy in the middle of the group, right? So they don't need to withdraw from the group to attend to their child's needs, right? They can, if they need a minute or baby needs a minute, they can mute themselves and they're still part of the group. They can take us with them if they need to change a diaper, right? So I think all these things were things that people really found to be meaningful there in creating that supported space to do this work and learn together. I do also think, though, although virtual delivery offers more convenience and flexibility, one thing I really started to think more about were some of the additional barriers that come up in accessing services when everything is virtual. So in the past, right, they'd have our address, a day and time that they're coming, and then once they get there, we would help them with everything. We'd be walking them through paperwork. Our admin assistant was there if they had questions about things. And so with this shift, there's more expectations on parents to be having to do some of this work on their own. And so one thing that we learned and has been very helpful from the feedback we're getting is to be more proactive in orienting people. So helping them understand the platforms we're using for our work. What are expectations of them? How can we reduce some of that burden, particularly for new clients coming to our clinic? Making sure they know how to reach us, ask us questions, right? If you're not sure how something's going to work beforehand, let us help you with it. Let's problem solve. And that's really been helpful over the course of the pandemic. And then a couple of things, I think, particularly to group-based programs. So I've certainly, confidentiality and privacy is a big thing anytime you're doing a group. But I think now we have people who are trying to create these private spaces at home. And I think that's been something that's been interesting to think about. So how do you create a private space for yourself, but also for the other people in the group? And so we've really had to try to set some clear ground rules from people and problem solve, right? Because especially early on in the pandemic, we had some people there were multiple adults maybe working in small spaces, right? So how do you create a private space for yourself, again, to kind of have this comfortable space where everyone can be sharing what they're going through together. So I think being really, again, proactive in that. And then the final thing I want to share is optimal group size. So this, of course, always depends on objectives of a group, if you're being more educational versus therapeutic. But this was counterintuitive to me that on Zoom, less is better than in person. I would have thought we would have been able to increase our numbers. But I think there's a lot that's a lot more miscommunication, a lot more checking in with people that we're doing. You can't just scan a room with a glance, right? You have to look at the top of your bar. And so we found it tends to feel it works better than what we would have had in person to have lower numbers there. And so finally, I'm going to really quickly share a little bit about what's coming next in our program. And I know I'm almost out of time as well, so it's good timing in that sense. But I'll plug some of our new programs. So, I think based on what we're hearing, what we're seeing, what our experience has been, we're going to be focusing more on prevention and early intervention with some of our newer programs. Again, particularly given what we think of these collective and individual stressors that new and expecting parents are facing. And so we just found out, it's like right hot off the presses, that we got a grant through a community foundation in Kingston and area that's going to be focused all about building family resilience through parent mental health. And a big piece of that will be some perinatal services. So one will be some therapy groups that are geared at new parents, new moms, and just supporting them in that transition, normalizing some of what's coming up, providing some education support so that they're getting what they need and trying to manage everything going on. And then also having some freely available educational outreach sessions that we'll be running. Again, really focused on how you support your emotional wellness during this transition period and in the context of a pandemic. So that's a little bit about what's coming next for us. And again, thank you so much for the opportunity to be here and share a little bit about our program.
Oh my gosh, that's so amazing. Such great initiatives. And Stephanie and I a couple weeks ago had a great chat. There's so much more she can share with you. So she's going to be a great resource for us here in the region. I think you raised a few important points about student mentorship. So it's so important as students go through their training and education that they really understand the importance of perinatal mental health for both the pregnant person as well as the partner. And so as Jillian was talking about, it's really about family wellness and looking at mental health in that perspective. And, I chuckle to myself about best laid plans, right? These grants and these initiatives, you plan one way, and boy, COVID's had a way of turning things upside down, but there's silver linings in that as well. There's been great opportunities and positive outcomes related to that as well. And it's exciting to hear that, again, with the preliminary evaluation, you are seeing a meaningful reduction of symptoms. So again, it's so exciting to see, like, how can we make a difference with different realities So it's so exciting. And the tips that you offered, I think, will be super helpful for people who are offering virtual education and support and counseling, or those who are thinking about, using these interventions. So thank you. And so if you have questions for Stephanie, please put them in the chat. And next we are going to go to Dr. Jasmine Gandy, just to make sure that she has time. Dr. Gandy is the medical director of the Ottawa Hospital Perinatal Mental Health Program. She established this program in 2007 to address the mental health needs of pregnant and postpartum women in the Capital Region. She's associate professor of psychiatry at the University of Ottawa, where her academic focus is on medical education in women's mental health and interpersonal psychotherapy. Currently, she is working with her team and regional partners on enhanced supports for mothers during the COVID-19 pandemic. And that's what she's going to talk about today. So welcome, Dr. Gandy.
Thank you so much, Christina. It's lovely to hear all the work that's happening around the region. And I feel really privileged to be included in this group that's speaking in this series. So, and I'm very cognizant of the fact that I'm actually speaking on behalf of my amazing team. Only a few of who I've been able to get some selfies on here in our various work from home or COVID gear in hospital. So Melissa Sully is our secretary on the very left, who keeps us completely organized, and we would be lost without her. Our two other perinatal psychiatrists are Dr. Lyndall Petit in the mask and Dr. Norris with her Christmas cookies, Dr. Sandia Norris, and they really are my partners in crime for this clinic. Linda Corsini is our social worker. She is just a force extraordinaire who keeps us connected to the community and always aware of the social determinants of health. Unfortunately, we also, I didn't get any photos of our lovely social workers in the obstetrics units, who we also work with antepartum women. And then we have a robust set of learners, and that's Dr. Marina Moharib, our psychiatry resident at the moment. I would be remiss if I didn't mention our lovely nurses, Lisa McKenney, Tara Adlington, and Nina Anderson. In my little speaker's notes here, I have it. They are the wall that keep us sane. So we're really lucky to have an amazing team to work with and to have gone through this incredible transformation with the onset of the pandemic. So Christina, if you don't mind changing the slide, I'll tell you a little bit about what we actually do. So we see women who are either pregnant or up to 1 year postpartum or up to 1 year post-adoption. We see adults who live in the Champlain LHIN, and we accept referrals from any TOH affiliated midwife, nurse practitioner, or physician. Most of our referrals come from the Department of Obstetrics, but they come from family medicine, the emergency room, psychiatry, you name it, throughout the system. And we're really focused on the assessment and limited follow-up to women during their pregnancy and up to 1 year postpartum as clinically indicated, for things like diagnostic assessment, treatment recommendations, pharmacological management, psychoeducation, supportive care, and a few of the different types of therapies that we do. The majority of who we see are perinatal mood and anxiety disorders, as well as an incredible share of psychosis, more than I think the literature would support that we actually see, which is interesting. We also see a lot of perinatal bereavement. We do one-time pre-pregnancy medication assessments for women that are on complex regimens. Our social workers, as I mentioned, they really do an incredible job helping our patients find resources for finances, particularly nutritional supports or childcare services, refugee services, connections for domestic violence, and various housing and community supports. We do offer a couple of group therapies. So the groups that we offer are only available by referral through a TOH affiliated psychiatrist. And there's a few modalities that we offer. The first is IPT, interpersonal psychotherapy, and this is an open-ended, an open group where each woman would attend 16 sessions. These are women either in their pregnancy or in their postpartum who are struggling with anxiety and depression or depression that was triggered by either an interpersonal conflict, the transition of having this new child, or potentially reactivated bereavement. We also offer a postpartum CBT group, and these are closed groups, about 8 sessions offered a couple of times a year for mothers who are struggling with behavioral activation, goal setting, working with identifying and challenging cognitive distortions for, again, depression and anxiety. There is another service which I'd love to make known, and that's e-consultation. That's available to any physician and I believe nurse practitioner in the Champlain region. And that's through the Champlain base e-consult service. So if anybody has not been aware of this or needs to register, it's e-consult support at linworks.on.ca. And I think I put that link in there in my presentation. So, this is available, like, as I said, to all MDs and nurse practitioners for any questions regarding medication safety during pregnancy and lactation for their patients. So that helps us to spread our services a little bit beyond the walls of the Ottawa Hospital. We are a teaching service, so we host a lot of medical students, 3rd and 4th year. We host junior and senior psychiatry residents. We host fellows in psychiatry, as well as fellows in family medicine who are hoping to specialize in women's health. And we also offer psychotherapy supervision, particularly in IPT and perinatal bereavement. So that's a huge component of what we do. Unfortunately, there's a few things that we wish we could do better, but just don't have the capacity to do at this point. And that is women who are primarily dealing with a substance use disorder, an eating disorder, a primary personality disorder, or capacity of parenting. Although we would love to expand in the future, at the moment, we don't deal with the psychiatric or psychological ramifications of infertility, premenstrual dysphoric disorder, perimenopause, and unfortunately, although I wish we did, we don't offer fathers direct service, rather indirect service as they support their partners. So maybe the next slide, Christina. Thank you. So what we were focused on before the pandemic, we had a lot on our plate. The Ottawa Hospital had actually just undergone the transition to Epic, which, if you haven't heard about it, it was initially a really horrible electronic medical record that pretty much broke us, or so we thought. And we were dealing with this for not quite 18 months before the pandemic started. But that transition to the EMR actually set us up so well, and we didn't realize how many silver linings there would ultimately be when we had to make that leap to virtual care come March break. We luckily were already starting to experiment a bit using OTN for providing virtual care to a subset of our population. And the idea was to do this in a really organized and mindful manner. But, luckily we had set ourselves up and then we're able to plunge right into it. So post-pandemic, we did continue without actually skipping a beat, all of our services initially through OTN. And then the hospital changed platforms to MS Teams. MS Teams we actually still use for administrative purposes. And I'd highly recommend some type of service like that if you're not already using something with your your clinical teams. It's where we can throw all of our files, we can chat with each other. We've really sort of embraced MS Teams as an effective way of internal communication. And then subsequent to that, the hospital introduced Zoom through Epic. So all of these were PHIPAA compliant platforms, which are also billable services. So as largely physicians, we were able to conduct our care on these platforms really nicely. Oh my goodness, I'm taking a lot of time. Okay, maybe I'll skip through some of this. One of the exciting programs that we did end up starting was TOH Pregnancy and Pandemic Support Group, and this was modeled on a service developed by Mount Sinai Hospital. Mount Sinai developed this model where they were providing virtual support groups that were half of an obstetrician who was presenting on all the COVID risks in pregnancy, as well as what to expect upon entering the hospital in terms of their actual delivery and delivery process. And then the second half with a perinatal psychiatrist. And that's the part that I lead, which really looks at not psychiatric illness, but actually mental health fitness and developing resilience in this extreme time of anxiety. So if I go to the next slide, Christina, we didn't have funding to do this, unfortunately. And so what we were able to do, and I alluded to this earlier, is actually to leverage our electronic medical record to create a way for patients to self-schedule through the electronic medical record once they had registered for their delivery. So we've only gotten 3 weeks into this, and we're really looking forward to sharing the results and collating the results of this program. And maybe I'll end it there, Christina, even though there's so much more to talk about, just to leave room for some questions.
Fair enough. Such innovative work and over many years, 13 years, leading the perinatal mental health program and evolving to increasing needs of families and different methodologies of providing care. So what was exciting to hear is the holistic care that's offered by your team. So the social workers addressing those social determinants of health, which are so important in addition to whatever clinical issue that people have. So that's really exciting. And we know that anxiety is so prevalent. And so when we talk about perinatal mental health, it really has to be the anxiety, the depression, as well as the other. And we've heard that from Stephanie, Dr. Boyer as well, regarding the programs that they're developing to address the anxiety. So I think, at this time, I'm going to stop sharing the screen. I'm going to flip over to my colleague, Carrie Ann Berga, to see what questions we have in the chat here for our speakers. And I'm trying to pin. No, I'm going to pin the speaker so we can.
Gotcha. Okay. Hi, everyone. Thank you. So we have one question. Jillian's interested in the name of the CBT program that was being used at the Queen's Clinic.
Oh, I wish I had, all my students have all my manuals. This is where I'd hold up my book, right? And so it's they've published a book. I can send it in the chat. Actually, it's available. So there's a self-help version of it, guided now. And it's really just called like Managing Anxiety, right? And Depressive Symptoms in the Pregnancy and Postpartum. So I can pass that on for people who are interested. It's fabulous.
That would be wonderful. Thank you. We do have, does anyone else have any questions? I don't see any in the chat right now. I'll give people the pedagogical 30 seconds here. And then I think that Hiltrud had a bit of an update to share. So if we could unmute Hiltrud, and then we can come back to any questions that pop up. Does that sound okay? Hi, Hiltrud.
Well, from all of you again. And Jasmine, just a little shout out. We were on a working group together. I don't remember. It was before you started at Ottawa. And I've been actually thinking about you lately and wondering how the program there is going. It is great to see all the excellent work you're doing. And of course, Stephanie, Jillian, and the parent advisor, can't remember her name right now, but those have been amazing resources. I just wanted to share. Stephanie prompted me with her CBT-based workbook that we've had a workbook based on a workbook from BC for quite a number of years on our website. So it's called Managing Depression, and then another tagline. So it is for pregnant and new parents with depressive symptoms. Mostly it's not quite so much anxiety, but it will work for anxiety too. And we are just in the process of updating it, and it will be written in gender neutral language, pandemic informed, so that we're focusing more on the virtual, that kind of thing, you know, those resources. It is a self-help skills book, so women can do it on their own. And the facilitation that we're doing with Life with a Baby to run virtual group is partially based on that, partially, I should say. But anyway, they will go hand in hand. And the new workbook will be available on the website. The old one is still there right now. The updated one will be there very shortly, hopefully within the week. That's just what I wanted to share. So it's great to see many resources. I think the more the merrier.
Yeah, thank you so much, Hiltrud, and we'll give a screenshot of the Best Start resource page. But I just realized, sorry, when I'm sharing my screen, I can't see the chat, and a few people did send me a direct question. So from Susan, what would lower preferred numbers be? So I think that has to do with Stephanie's comment. So do you have any guidance about the size of the group?
I can tell you what's working for me and for us, but of course it's so dependent on the program. For us, I've been capping it at 5, and we're finding that that's been working well. Yeah, whereas in person, I'd usually go higher.
Thank you. And another question from Sonia, who can partake in your program? So geography or other criteria?
Yes, so we mainly take people or get referrals for people in KFLNA, so Kingston, Frontenac, Lennox, and Addington. We can see people outside of our catchment area. We tend not to go too far out because we just don't know as much about the resources, right, as we're going further out. And we know that a lot of times there's other programs that are doing what we're doing, but we're always happy to connect people if they're wondering. And absolutely, we do tend to see some people in more rural areas as well, where they may not have access to programs in other places.
Yeah, it's really good. And Stephanie, when we talked a few weeks ago, it was that intake process, which is actually quite comprehensive, and it's like a guiding, like what stream makes sense for you, what might be appropriate. So yeah, don't hesitate to reach out, and they'll set you up in the right direction if their program's not the right one. There was a question from Doris about the mental health presentation. When will that be available? So I don't know if that's for today's presentation or last week, but we are working on the conversion as quickly as possible. So I hope very soon. We will send out an email directly to you. So my colleague Ariane Cloutier will be connecting with anyone who's registered for last week's webinar as well as today, with the recording links as well as additional resources that have been shared. And Jasmine, do you want to talk about some of the resources that you sent today to be shared with the group?
Yeah, absolutely. I mean, there's an amazing amount that we've heard about here, but new resources that have developed. Pregnancy in a pandemic, the Instagram group is a major one. You know, as always, our incredible Ottawa Public Health partners have a fabulous resource there. But yeah, they're all collated in that PDF, which Christine, I think you said you'd be able to post shortly. So yeah, absolutely.
Yeah, we'll be posting all that to the webinar page. So where everyone click to register, that's where you'll find it. There's a question here from Sherry. Is there evidence-based anxiety resources you would recommend for parents? So I don't know if that's a question for Jasmine or Stephanie. Who wants to take that one?
Well, there's a lot of mindfulness apps out there that are excellent. So mindfulness is a useful tool to use once the anxiety is settled a little bit and you can actually use the tools of mindfulness. It's not necessarily the best intervention to treat acute anxiety, clinical anxiety disorders necessarily, more in conjunction. So offhand, I'm not remembering. There is a perinatal specific one. I'm going to see if I can find it in the meantime, but I really like Headspace and Calm as two very good mindfulness programs. And yeah, it's called Mind the Bump is the mindfulness meditation tool for new and expecting parents. And then I would also give a shout out to the Center for Mindfulness Studies based in Toronto. They have their MBCT, MBSR, and Mindful Self-Compassion, MSC, meditations freely available through their app. So those are all really good, useful resources. And then, of course, to remind, this is not specific to the perinatal women, but there's also Bounce Back Ontario, where you can get CBT delivered, a short course of CBT delivered over the telephone. So that's an evidence-based intervention as well. Stephanie,
I'll piggyback off that just to say, I think they've actually got a perinatal module now. I had a client that was just telling me about it. So I didn't know, I knew about Bounce Back, but they've got a module now.
That's awesome. I hadn't heard about that either. That's so good. That's awesome. Carrie or Catherine, did you guys get any other questions in the chat? I want to show you a few resources, and then I think we'll wrap up for today. We did go over a little time. Thank you for your attention. Continued.
I don't see any other questions right now. I have opened up the chat though, so people can pop information in there.
Okay, so this is a screenshot of the Best Start resource page. So again, they have a ton of resources related to mental health. So the resource that Hiltrud was talking about, the self-care workbook is in there as well. And Catherine put the link in the chat box. Last week, I mentioned a handout. So I know some of our level 1 centers in the area are providing this on discharge to families after they give birth. So basically, what are the signs and symptoms of a postpartum mood disorder, and where can you get help? So again, doesn't matter where you are, these resources here are accessible. So looking at your public health unit, and then some provincial and national resources as well. There is an online course developed by Best Start Resource Center to help providers learn more about this issue. So this is available just in English at the moment. And the Registered Nurses Association of Ontario has a whole best practice guideline, which is packed with amazing resources, screening tools, and other resources that might be useful to you. I do want to put a shout out to our colleagues at the Canadian Centre on Substance Use and Addiction. They are having a webinar coming up next week, so the 30th, and it's not specific about perinatal mental health, but I find it really helpful to be connecting with other agencies and organizations who are in the world of mental health and addictions, and particularly, what's happening with the lens of the COVID-19 pandemic. So do look at the ccsa.ca website, and they've been hosting amazing webinars throughout the pandemic as well as before. I want to sincerely thank all of our panelists today, Charlotte Maloney and Jillian Zolos and Stephanie Boyer and Jasmine Gandhi. Thank you so much for sharing your expertise. It's so inspiring to see what's happening. I've said this before, it's so inspiring to see how flexible and nimble you've been during the pandemic to flip the programs, to just really respond to the need. It's making a really big difference to families. There's more work that we can keep doing, but you're so inspiring and encouraging, I think, when we have these webinars and that message, we can do this, and here's some tricks about how we can do it a little bit easier. So thanks for sharing your expertise piece, thanks to everybody for joining us today, and we look forward to continuing to have conversations about this important topic. So do have a great night, and we'll be in touch with the links to the recordings. So take care, everyone.